Welcome to the discussion of psychopharmacology, or the study of drugs in treating clients with psychiatric mental health problems. Medication management is a crucial issue that greatly influences the outcomes of treatment of many clients with mental disorders. We will discuss the several categories of drugs used to treat mental disorders. The different psychotropic drugs, such as your antipsychotics, antidepressants, mood stabilizers, anxiolytics, and stimulants. Okay, so nurses should understand how these drugs work, including their side effects, contraindications, and interactions, and the nursing interventions are required to help clients manage medication regimen or a problem arising from the intake of such medications. Kaya nga meron tayong drug study. So several terms are used in the discussions of the drugs, such as efficacy. Pag sinabi nating efficacy, from the word efficiency, efficacy, it refers to the maximum therapeutic effect that a drug can achieve. Okay? Halimbawa, yung paracetamol natin, yung efficiency ng paracetamol na tablet is usually for clients who have fever na umaabot ng at least mga 38 degrees Celsius. Okay? So more than that, lalo na for children, more than 38, pag nasa 39 na, we need to use Acnel or a paracetamol that is inside your ampule and given intravenously. Kasi yung efficiency niya is mas mataas na. Okay? So hindi na kaya ng regular paracetamol tablet yung taas ng body temperature. So that's efficiency. So the maximum efficiency of your paracetamol tablet is for clients with 38 and below body temperature. Another word is your potency. So pag sinabi naman nating potency, it describes the amount of the drug that is needed to achieve the maximum effect. Okay? So hindi tayo gumagamit ng 250 milligrams na paracetamol para sa adult, but rather 500 milligrams of paracetamol, okay? Because that's the potency that is needed, okay? That's the maximum, that's the amount of grams of the paracetamol to achieve the maximum effect for that clients with fever, okay? So, meron tayong mga gamot na tinatawag na low potency drugs, okay? Low potency and high potency. So, pag narinig ninyong, very potent yung drugs na to. Very potent yung drugs na to. Ibig sabihin, kunti yung amount ng drugs pero malaki yung epekto. Okay? Malakas yung epekto. So, pag sinabi namang low potency drugs, ito yung malaki yung amount ng drugs pero kulang yung effect. Okay? So, kailan nagkakaroon ng pagkakaiba to? Usually, kapag mga branded at saka generic medications. Okay? So, halimbawa, bumili ka ng paracetamol which is generic in nature, tapos meron kang biogesic. So, mas mataas yung higher potency yung paracetamol ngayon na biogesic. Okay? So, ganun din sa iba't ibang antibiotics and different antipsychotics medication or psychotropic drugs. Okay? So, low potency drugs require higher dosage to achieve efficacy, whereas the high potency drugs achieve efficacy at lower dosages. Okay? At lower dosages. Okay. So, meron din tayong tinatawag na half-life. Okay? In the study of drugs. Okay. So, meron tayong half-life. Half-life is the time it takes for half of the drug to be removed from the bloodstream. Okay? So, pag sinabi nating drugs with a shorter life, okay, a shorter half-life, it may need to be given 3 or 4 times a day. So, pag shorter yung half-life, ibig sabihin, mas mabilis maubos yung effectiveness. Okay? Mawawala agad yung drugs dun sa katawan ng tao, ilalabas na agad, itatapon agad. Okay? So, hindi pang matagalan. Usually, maikli yung buhay. Okay? So, maikling panahon lang na iepekto yung gamot. For example, for antibiotics, we use antibiotics kasi ito naman talaga yung common. So, we use amoxicillin or erythromycin developed by a Filipino. Okay? Kung alam niyo yan. So, compare your erythromycin to your clarithromycin compared to azithromycin. Okay? So, kung titingnan natin ngayon, yung erythromycin is given 3 times a day. Okay? So, usually it is given 3 times a day. Kasi mas maikli yung half-life, shorter yung half-life compared to your clarithromycin, that is, yung clarithromycin usually given BID. Okay? Mas mahaba-haba ngayon yung half-life ng clarithromycin compared to your erythromycin. And if you are aware also of the drugs ngayon, okay, lalo na ngayong merong COVID, azithromycin is given for clients with respiratory disorders secondary to COVID-19. Okay? So kahit sa hospital, common yung azithromycin given in clients with tuberculosis. Sinasabay ito sa drug medications, okay? Or sa medications ng mga pasyenteng merong tuberculosis o kaya merong mga severe acute respiratory syndrome. Okay? Hindi lang SARS-CoV, hindi lang SARS, but also other respiratory infection. So yung azithromycin is given only for 500 milligrams lang, 500 milligrams lang. Ibig sabihin, high potency yung azithromycin, tapos matagal yung half-life ng azithromycin. Bakit? Kasi yung azithromycin, yung 500 milligrams na azithromycin is given for clients na ng isang bisis sa loob ng isang araw. Ibig sabihin, isang bisis ka lang iinom ng azithromycin sa isang araw. Okay? So yung potency niya mataas, yung half-life niya mahaba, at the same time yung efficacy niya mataas. Okay? Mataas yung efficacy ng azithromycin, mataas yung potency, mataas yung mahaba yung half-life. Okay? So ito yung mga pagkakaiba ngayon ng mga luma at ng mga bagong gamot. Okay? Kaya nga meron kayong maririnig na first generation, second generation, and third generation, lalo na sa mga cephalosporin. First generation, second generation, and third generation. Okay? Cephalosporin. Yan yung mga common na maririnig ninyo, makikita ninyo sa mga drug study natin. Okay? So, meron din tayong tinatawag na off-label use. Wala sa indications. Halimbawa, let us give an example. Diphenhydramine. Diphenhydramine is given as antihistamine for clients with a runny nose. Okay? Or, ano pa? Kung merong pamamaga sa mukha. Okay? So, usually, because it is antihistamine, basically, antihistamine siya. Pag merong allergy yung tao, pwede mong ibigay yung diphenhydramine, lalo na kung wala ka pang gamot na available na mas malakas, na mas mataas yung efficacy, mas mataas yung potency. Okay? So, temporarily, you can give diphenhydramine, which is used for running nose or colds for patients who have an allergy. Okay? Ano pa? Bonamine. Bonamine is also an antihistamine. Pero kadalasan, ano yung gamit ng Bonamine sa Pilipinas? Yung Bonamine, para makatulog lang yung nagbabiyahe during transportation. Okay? Another off-level example, Viagra. Yung Viagra, okay? Yung Viagra binibigay sa mga taong merong impotency. Okay? Impotent. Hindi tumatayo yung ari. Okay? Walang kakayahang tumiga si Manoy. Okay? So, ano ngayon yung pwedeng off-level use ng pasyente ng Viagra? To be a medication for clients na mababa yung heart rate. Pampataas ng heart rate yung totoong epekto ng Viagra. Kaso nga lang, during the study, okay? So during the observation, nakitaan nila na yung mice na lalaki, pag pinapainom ngayon ng sildenafil Viagra, okay? So pag pinapainom yung mice ng Viagra, pag binibigyan, nag-i-introduce ng Viagra sa mice, nakikita nila na nagkakaroon ng erection yung mice. Okay? So doon na lang binago, imbis na yung sildenafil is gamitin para itaas yung heart rate ng patient, it is now converted para sa mga pasyenteng merong impotency as an answer for the impotency problem. Okay? So ganun yung label, yung nakalagay sa label para gamitin for the impotency. But the off-label use of your Viagra is to increase the heart rate. Kaya nga nung nasa San Lazaro Hospital ako, sabi ng estudyante ko, sir, merong Viagra yung estudyante ko. O bakit ka natatawa? Bakit merong Viagra na gamot yung pasyente mo? Sabi, dinggi naman sir yung sakit ng pasyente ko Bakit kailangan Tapos babae. Okay? So sabi ko naman, dahil yung Viagra, tinataas niya yung heart rate. Yung pasyente mo, mababa yung heart rate because of dengue. Okay? So that's the off-label use of the drugs. Okay? So also, an example of these are some anticonvulsant drugs, okay, that is usually approved to prevent seizures that are prescribed for their effects in stabilizing the moods of the client. So, dito nga, anticonvulsant, prevention of seizure. Pero at the same time, yung off-label use niya, aside from being anticonvulsant, is stabilizing the moods of clients with bipolar disorder. So, when you are asking for clients, lalo na yung mga pregnant, kasi yung anticonvulsant drugs is a cause of congenital defect. Okay? Lalo na yung cleft lip and palate. When the pregnant client is taking anticonvulsant drugs, merong teratogenic effect yung anticonvulsant drugs. Okay? So hindi lang yung merong convulsion, yung tatanungin mo kung nagtitake ng anticonvulsant drugs, you will need to ask also patients with bipolar disorder na pregnant. Bakit? Dahil maaaring they are given anticonvulsant drugs, okay, as off-label use to stabilize their moods. We follow guiding principles during pharmacologic treatment. So the following several principles are used by the nurse in giving medications to treat psychiatric disorders. Number 1, a medication is selected based on its effect on the client's target symptoms, such as delusional thinking, panic attacks, or hallucinations. So we give medications for the purpose of alleviating or curing or treating the target symptoms. So we don't usually give medications just because of the diagnosis of the patient, but rather because of the signs and symptoms manifested by the clients. So the medication's effectiveness is evaluated largely by its ability to diminish or eliminate the target symptoms. So kung nakakatanggal o nawawala o nababawasan, maganda. Ibig sabihin, maganda or epektibo yung gamot. Okay? Number 2, many psychotropic drugs must be given in adequate dosages for some time before their full effect is realized. Ibig sabihin, may mga medications tayo na binibigay sa mahabang panahon, hindi lang sa loob ng ilang oras o ilang araw o isang linggo, kundi maaaring isa o isa't kalahating buwan katulad ng tricyclic antidepressant bago magkaroon ng optimal therapeutic benefits para sa isang pasyente. Tanong sa mga NCLEX questions na sinasabi. The client says that the tricyclic antidepressant has no effect on her. What is the response of the nurse? The nurse would ask for, when did you started taking medications for tricyclic antidepressant? Okay? So ito yung isang response palagi ng nurse. Kailangan itanong kung kailan. Bakit? Kasi kung isang buwan pa lang, maaaring nasa isa't kalahating buwan pa bago umipikto. Okay? So moody pa rin yung patient, depressed pa rin yung patient. It's because that the optimal therapeutic effect of the drugs has not yet been reached. Okay? So hindi pa inabot. Maaaring sa karagdagang 2 linggo pa kung isang buwan pa lang nagtitake ng gamot. So depende pa rin sa tao. Okay? But usually, tricyclic antidepressants get effective or receive its optimal therapeutic effect within 1.5 months of taking the drugs. Number 3, the dosage of medication often is adjusted to the lowest effective dosage for the client. So sometimes a client may need a higher dosage to stabilize his or her target symptoms, whereas lower dosages can be used to sustain those effects over time. Ito yung mga sinasabi nating double dose dahil initial dose ngayon ng pasyente. Ibig sabihin, unang painom o unang bigay ng gamot, dino-double dose, okay, ng ibang doktor. Depende kung ano yung situation ng patient. Bakit dino-double dose? Para abutin yung therapeutic effect na gusto at saka makita yung pagbabago sa unang bigay pa lang. Okay? So pag na-achieve yun, halimbawa, merong depression yung patient, yung therapeutic effect ng gamot nag-manifest, isusustain na lang yung mas mababang dosage ng gamot para sa pangmatagalang gamutan. So parang ano yan, parang antibiotic yan. Meron tayong mga double doses sa antibiotic during giving initial dose. So mas malaki ng karaniwan o kaya 100% yung increase. Tapos yung second dose mababa na dahil isusustain na lang yung effect ng gamot for the overtime used. Number 4, as a rule, older adults require lower dosages of medications than younger clients. So it may also take longer for a drug to achieve its therapeutic effect in older adults. So bakit kailangan nating bawasan o babaan yung therapeutic dose para sa matatanda? Bakit hindi pwedeng itulad sa ibang adults? Bakit? Dahil nag-i-start ng mag-devolve yung functions ng katawan, ng mga organ. So, maaaring yung normal level or standard therapeutic level, yung normal dosage, para maabot yung efficacy ng drugs, maaaring makasama na para sa matatanda. So we use this lower dosaging of these medications para maiwasan yung tinatawag nating adverse reactions for older adults because of the decreasing body functioning and body capacity to receive medications. Okay? Alam naman natin na yung medications tinatawag ding double edge. Kung meron kang therapeutic effect, at the same time, it has also its own side effects and adverse reactions. Okay? So kung maaring ito ay nakakagaling, ngunit may mga dala rin itong masamang epekto sa katawan. In clients who are receiving psychotropic medications, pagpagaling na yung patient, pag nakikita ng merong pagbabago sa pasyente, gumaganda na yung mood ng patient, hindi na depressed. So some psychotropic medications ultimately be stopped, okay? So, magkakaroon ng stoppage ng paggamit. Pero, in a psychotropic medications, we need to understand that abrupt stoppage of the medications may cause 3 problems. So, tatlo. So, when planning to stop psychotropic medications, you need to gradual decrease of the dosage of medications. Tinatawag natin itong tapering of the dosage. Titer. So, paunti-unti yung pagbawas ng dosage ng medications to give the body the chance to produce, sa steroids, it's steroid therapy. So, hindi mo pwedeng basta-basta ihinto yung steroids kasi yung katawan na sanay na merong exogenous source. So, pag bigla mong tinanggal yung steroid medications, the tendency, the body will not produce steroids anymore. Ganon din sa psychotropic medications. Neurotransmitter will be stopped. So, yung production ng mga neurotransmitter might stop. So, kailangan gradual yung decrease via tapering or titering. Ano yung iniiwasan natin with the abrupt stopping of the medication? Okay? Kasi meron tayong tatlong potential problems katulad ng rebound, recurrence, at saka withdrawal syndrome. So, ano yung rebound? Rebound is the temporary return of symptoms. Ibig sabihin, sa maikling panahon na tinanggal mo yung gamot, biglang bumalik yung mga dating sintomas. Okay? So, ang kagandahan doon sa rebound, naaalis ulit yon. It's temporary return of the symptoms. Ngayon, ang problema kung hindi rebound yung mangyari sa patient mo, magkaroon ng tinatawag na recurrence. Ano yung recurrence? Recurrence is the return of the original symptoms. Parang bumalik. Gumaling na tapos bigla mong in-stop yung medications, balik na naman yung problema. Meron na namang insanity. Meron na namang depressions. Mas malala kung meron ding tinatawag yung pangatlong problema, withdrawal syndromes. Okay? So, ano yung nangyayari with withdrawal? Merong mga bagong symptoms, new symptoms resulting from discontinuation of the drug may occur. Okay? So, merong bagong susulpot. And the patient, after therapy, medication regimen, another principles that needs to be observed pharmacologic treatment of clients with psychiatric disorder is yung follow-up care. It is very essential to ensure compliance with the medication regimen. Health check-up na to is very essential para masigurado na merong compliance yung pasyente. It also very essential in making adjustments of dosage of medications and managing the side effects of medications if ever na yung patient is nasa home therapy na lang. Number 7 of the principles that we need to observe is compliance with medications. So kung kanina follow-up to ensure compliance, kaya naman talaga compliance na yung principles na susundin natin. Kaya nga, meron tayong mga bagong medications ngayon, merong mga new generation drugs, katulad na lang ng antipsychotic drugs natin, mga new generation drugs na given in depot injection. Compliance with the medication regimen is often enhanced when the regimen is simple as possible. Ibig sabihin, yung gamutan, simple, pero epektibo. So, mas kukunti yung medications, mas maganda. Halimbawa, sa PTB, historically, yung PTB, meron kang 4 na gamot. Okay? So, meron tayong sinusunod na medications or umaabot pa nga ng 5 pag medyo mataas na yung pag meron ng resistance yung sa medications yung patient. Okay? So, meron tayong iba't ibang klase ng PTB, di ba? PTB 1, 2, 3. Okay? And PTB 4. Okay? Kung mayroong mga recurrence. Yung gusto kong ipaabot is, kung simple yung home regimen, mas madaling i-comply ng patient. Okay? Bakit mas madaling i-comply ng patient? Halimbawa, sa PTB drugs dati, the patient needs to take 3 tablets to 4 tablets a day. So, hindi yun simple. Madami yun. Okay? So, sa ngayon, yung ginagawa, sa isang capsules na binibigay, caplet. Okay? So, isang caplet, nandun na lahat yung HRZA drugs. Okay? So, it makes the medication regimen as simple as possible that increases the compliance kasi isang basis ka lang iinom. Halimbawa, katulad din ng azithromycin. Azithromycin is given for clients with respiratory problems. Okay? Isang basis lang iinumin sa isang araw. So, nagkakaroon ng mas maayos na compliance dahil hindi nakakalimutan ng pasyente. Isang basis lang iinom. Okay? So, meron din tayong mga new generation antipsychotic drugs. Katulad ng aripiprazole. Okay? So it takes, yung isang injection will take at least 4 to 6 weeks. Okay? Yung effect. So isang buwan, magpapa-check ka para sa gamot mo and you are free from depressions. So naturally, the compliance will be very high. Okay?